Welcome to the Progression Health Podcast. This is episode 49. Back on the podcast is Dan Feldman. Dan, do you want to introduce yourself?
Sure. So I'm Dan. I am a registered dietitian. I have my master's degree in human nutrition, and I am also a recreational competitive powerlifter. I have a full-time private practice, a virtual private practice. I work with clients in the United States who take their health insurance, working, whether it be weight loss, muscle gain, other, conditions that people need, nutrition help for. Also a personal trainer. And I guess that's just me in a very brief nutshell.
Yeah, one of the good guys in the fitness industry, I would say. So Dan, the whole using your health insurance for working with a dietitian back in Ireland, that's not really heard of. I even feel like in the US, it's kind of a newer type of trend. Is that fair to say it's a newer trend? And how does it work exactly? So does someone need a diagnosed condition to work with you, or is it just a case of I have health insurance, yeah, I'll work with Dan?
So if I were to get into the details, it would take a long time and it would bore all of your listeners to death. So I'm not going to do that, but it's newer in that, so you may be familiar with something called the Affordable Care Act. It was passed a little over a decade ago in the United States. Basically with that, services, healthcare services that are considered preventative, such as, annual doctor's visits and vaccinations, if you have health insurance, like a standard type of health insurance, they're covered at no cost to the consumer. And nutritional counseling from a dietitian is considered preventative. Now, what kind of diagnosis you need and referrals and how many kind of visits really depends on the plan. It depends on the health insurance company. Like I said, I'm not going to get into too much details about that. But yeah, for many people in the United States, probably for the majority of people who have regular health insurance, essentially, they can see a dietitian without paying out of pocket. But again, it may depend on certain diagnoses. Like I said, if I were to get into more detail than that, it would probably be super boring, but yeah.
Interesting. So something I was thinking of in my work recently, just as a one-to-one personal trainer, is that personal training is a little bit of a luxury, right? So it's like, obviously there's a barrier, there's a monetary barrier to it. And like, to be able to help most people, it's quite tricky, So, yeah. Would you think that help to work with a dietitian through your healthcare, is that more of a luxury, or is it kind of open to everybody, do you think?
I think it's more open to everyone than personal training might be, because a lot of people in the United States, probably most people, do have health insurance in some form, whether it be through their job or if they buy it on the public marketplace or something like that. So it's definitely accessible to a lot more people than paying for something, just out of pocket, like personal training or a nutrition coach who's not, through insurance. But that said, like I said, there are certain kind of insurance plans where maybe it's not covered, and not everyone has health insurance. So it's not completely inclusive, but I do think it has a lower barrier to entry financially, which is something that's, important to me, to be able to help people who might not be able to afford paying lots of money to see a dietitian. Because it's important, especially for people who may have a lower income, who can't afford to see a dietitian. They need to eat healthy too.
Absolutely, yeah. Like, as in, health is available to everybody.
Yeah.
So just out of curiosity, just because maybe I'm a bit ignorant, how commonly known is it that people can use their health insurance to work with a dietitian such as yourself? Like, do the majority of people know? Is it only the minority?
A lot of people don't realize, honestly. And oftentimes people are surprised, I'll put on my Instagram, like, hey, I accept health insurance. If you're interested in scheduling an appointment, learn more. And people are like, I could do that? I had no idea. So and also, a lot of dietitians in the United States don't accept health insurance because the process of doing so as a dietitian can be a pain in the butt, to do all the paperwork, to get, credentialed with insurance companies. It can be an arduous and difficult process, and learning how to bill claims and all of that stuff. So a lot of dietitians don't do that. But yeah, a lot of people are surprised that that's a thing, that someone who has health insurance can see me. I've got a number of clients who see me, every week or every other week, who pay nothing. I mean, they pay their health insurance premiums, but they pay me nothing. And I get paid by their health insurance companies, and I get paid well by their health insurance companies, and they can see me every week, which is I think is absolutely incredible, and something that I think more dietitians in the United States should take advantage of.
Great, yeah, and that I'll make a bit of an over assumption here, but you're keeping people who could potentially go to hospital out of hospital, and also improving their health, having a positive impact on their health based on how knowledgeable and skilled you are. So that's a win-win.
Yeah, that's the idea. That's the whole idea of the Affordable Care, at least this aspect of the Affordable Care Act, is having more of an emphasis on preventative coverage, because in the past, in the United States, there was more kind of like a focus on people who are already sick, but if we can prevent, long-term illness, and I mean, nutrition is an essential part of preventing, later health burdens, heart disease, diabetes, obesity, all of that stuff. I mean, it saves the healthcare system money in the long term, and obviously improves people's quality of life by having that preventative, focus.
Yeah, that's a really good way to look at it. Prevention is better than the cure. Isn't that how it goes?
Mm-hmm.
So
something like that.
Something like that, right? So who do you typically work with then, given that you've just mentioned preventative? So what's your typical client look like?
Yeah, so it's largely people who have body composition or strength goals sometimes too. So I mean, the most common is weight loss, fat loss, or people who do want to need nutrition guidance for building muscle or strength, or improving athletic ability, stuff like that. Because I do have the interest there. I'm a competitive powerlifter, personal trainer. But I do have people come now and then who have, a bit more specific issues such as diabetes, or, people who have a history of disordered eating. Sometimes I'll work with them to improve their relationship with food and develop, a kind of a healthier, eating pattern there. But, in general, the majority, it's probably, some version of fat loss, or weight loss, or maybe kind of related issues, triglycerides, reducing blood cholesterol, things like that.
Brilliant. So it's kind of like anyone with health insurance who's able to be covered to work with a dietitian such as yourself. Would you be confident to say you could help them improve their nutrition for almost most cases? Maybe there's some exceptions.
Yeah. So if I'm in net, and again, I don't want to get in the details, but if I am in network with their insurance and their insurance covers it, I just think I can be of help to most people who need it. And if not, I can refer. I've plenty of other dietitian contacts of other dietitians who accept various health insurances, like, or if someone has an eating disorder, I may refer them to a dietitian that specializes in that, or certain gastrointestinal issues. But yeah, I mean, the idea is to have healthcare be a bit more affordable.
Brilliant. Yeah. I can attest to your referral links. I had Dr. Dahl on for the vitamin D episode couple of months back. So
Excellent.
And telehealth then, basically, so you can do a virtual, you could consult with someone anywhere in the US, provided they were covered, and help them as well.
Yeah. So then there's some more kind of nuances there, whereby different states in the United States have different laws regarding licensure. So I'm licensed in the state of New York. There are certain states, such as California, where you don't need a California license, if I'm remembering correctly, to actually practice there. So if I see a patient via telehealth, and they're located in California at the time of the service, it's considered, it technically counts as me performing that service in California. since California doesn't require licensure, it's fine. Whereas if it was a state like South Carolina, it does require licensure. I would legally need to have a license in South Carolina to perform medical nutrition therapy in that state. Now, again, things get really complicated there, but so it just depends on the state. And then even with licensure, there are a lot more technicalities, which I won't get into, but people in various different parts of the country, I can work with via telehealth.
Yeah. Okay. So if someone's listening and they're looking to improve their health and they live in the US and they also have health insurance, it's potentially worth looking into working with you, because you'd be able to help them regardless of their nutritional challenges, by the sounds of it. So that's great.
Yeah. Yeah.
So what I'm thinking of next is just kind of getting into a specific situation. So right now I'm going to go back to tracking my macros, right? And basically I have my powerlifting goals, my running goals, and I'm like, right, it's not so much physique related that I'm going to track my macros, but I'm going to do it for performance. So like, if I have these kind of goals, which are like long-term and I'm really committed to do them justice, I want to get the best bang for my buck, we'll say. So in terms of tracking macros, do you think that a person, let's say a hypothetical client or clients you've worked with, you can track macros without having the effects of like rigid dieting that come with it? Like, is there a way to kind of have the benefits of tracking macros with almost next to no side effects? Or is it just a given that you're going to have like maybe obsessive thinking around food and stuff like those side effects?
Yeah. So I'm going to give you a real kind of cop-out answer, but then I'll kind of follow it with some more nuanced explanation. The answer is that it depends. It really depends on the person. And as a practitioner, so hypothetically, I was working with you and you wanted to track macros for performance goals. It's really up to me as a practitioner and as us, kind of working collaboratively to determine whether that is a good approach or whether it would lead to, obsessive thinking and stuff like that, so it really depends on the person there. I do think for many people, tracking macros can be done in a way that is, not harmful to psychological health. I think a lot of that comes down to having a flexible, mindset rather than a rigid mindset. For example, if you, maybe rather than having to hit every macro to the gram, maybe we have ranges, or maybe it's specifically calories and protein that we're kind of more focused on, and maybe, we don't necessarily feel the need to track every gram of rice. We can allow a little bit of, wiggle room too, or, just kind of going along with my last point. If we do go over the targets, we don't, try to overly restrict the next day. And we still, have some sort of like routine in place. A lot of people will just track macros and just kind of eat whatever as long as it's within their macros. I would say for many people, it probably makes sense to have some semblance of a meal or snack routine just to have some regularity there and consistency. But again, it depends. For some people, macro tracking will really not be a great fit. For other people, it works wonders. And it really, like I said, it really depends on the individual.
Yeah, absolutely. You got to take it on a case by case basis. So something I was thinking of just kind of considering tracking macros before I did is I'm like, so there is the potential that being more focused on your food by tracking your macros, in my case, so I basically tracked my macros before in the past, and I felt like I was at risk of like disordered eating. I would say I didn't have a full blown eating disorder, right? But I became like so aware of my food, and I became like I definitely binge ate a few different times, and I was like, this is not what I want my nutrition to look like. So, basically I was kind of thinking, right, I could try and work through it by tracking my macros, right? But then also at the same time, it's like, who's to say that, people who are completely unaware of their nutrition don't have like eating disorders as well, So it's kind of like, the point I'm trying to make here is like, there might be eating disorders. Someone might have an eating disorder, right, without tracking at all. And they might just be blissfully unaware and have poor nutrition. Or someone might have the opportunity to work through that eating disorder by tracking their macros. Does that make sense?
I think so. I think so. So it's basically that there might be kind of the underlying disordered eating there, and it might not be the tracking macros like causing it per se, but for some people it can kind of exacerbate sort of existing issues there. One thing I will say is I think if someone has an eating disorder, because an eating disorder is a diagnosis, they should not be tracking macros. They should be working with someone who specializes, a dietitian and therapist who specialize in, eating disorder treatment. And that I would not involve tracking macros. And people who have a history of eating disorders or disordered eating really ought to be careful. I don't want to say they should never, but track macros, but just need to be careful. Would probably do well, working with, if they do want to track macros, maybe touching base with a practitioner, just to make sure, because I do think that for people who do have a history of an eating disorder, or disordered eating, it can be easy for tracking macros to turn into an excessive focus on extrinsic eating cues rather than intrinsic eating cues, which I think is not a good thing, particularly for people who have that, disordered eating or eating disorder history.
Yeah, absolutely. Getting too caught up in what's going on externally. And I will say then, just in my own experience, that I tracked macros. I became more aware of food and my nutrition. And then I was able to eat intuitively based on how I felt. Like I came out the other side with a much better relationship with my food. So, it's definitely not a case that you track your macros and you develop an eating disorder, but you'll definitely become more food focused. So just out of kind of curiosity, what do you do for your own nutrition? So you're like the nutritional expert, right? So do you kind of advocate for intuitive eating as the gold standard for nutrition? Do you try and do that yourself? What do you do?
Well, so I don't advocate one thing or another for being a gold standard. Because again, I think just how people should approach their nutrition is very individual specific. I personally do track, my macros most of the time. I track macros more so with a focus on ballpark calorie range, ballpark protein range, to making sure I'm getting enough carbs and fats, more so just to support my training. I'm also a pretty quantitative person. I like numbers. So that's what I do, but also paying mind to my internal eating cues as well. And obviously food quality, eating a lot of fruits and vegetables, and stuff like that. So nothing too fancy, but again, that's just what works for me. What works for other people just really, really just, it depends on the individual.
Yeah, it's making me think that if what someone is doing with their nutrition isn't working, it's definitely worth trying something different, like intuitive eating, like tracking macros or whatever, just being conscious about what you're doing to try something different, because it's very possible to have like a really good relationship with food where you're happy with how your physique looks and you're happy with, the satiety and the fullness you're getting from the food and being healthy. You can kind of, is it fair to say that it's a reasonable goal for a lot of people to have like a healthy relationship with food and with their body?
I do think that is a reasonable goal for most people, is to have, a healthy relationship with food and a healthy relationship with their body. I think that's something that really everyone should strive for. And that looks different for different people. But at the end of the day, you want to be eating in a way that supports your physical health and your mental health too. And if you're eating in a way that adversely affects your physical health, or adversely affects your mental health, or really, where that creates an excessive amount of food focus or really takes away from your life, then that's where I think people can run into trouble. And I think, more generally, I see it a lot with people who have, ambitious fitness goals. It's easy to, because fitness should enhance our life, right? And I think it's easy, particularly for people who have aggressive fat loss goals or really, really, really ambitious muscle and strength goals. It can be easy to lose sight of the bigger picture, and to become, overly anxious or overly kind of concerned with our appearance, for example, our level of leanness or how much muscle we have. Because like I said, that stuff should enhance our quality of life. So that's something, we really need to keep in mind.
Yeah, absolutely. It definitely should be additive and not subtractive for our quality of life. And it really can be. That's kind of why I'm so passionate about exercise, is that exercise really, when it comes down to it, it enhances my life. So I'm just thinking of my own experience with clients and in one-to-one training. Typically, a lot of their goals are physique related, and I'm making a big push now to try and get people sort of to think more like, I feel like a physique goal is like external, and trying to internalize their fitness and think about like, what does it do for their internal, their mindset and their mood and stuff like that. What's kind of like a typical like reason that people want to change their nutrition? And I say that as well with the current nutritional environment, or the landscape, is that like, roughly 60% of Americans are like overweight. So it's only natural that they want, like, fat loss is a common goal. But do you see that with your clients who come to you for your dietitian skills, or is it something different?
Yeah, so I mean, there's a lot of reasons why people might, want to, enhance their, or change their nutrition habits. I mean, certainly it is common for people to want to look differently, for good or for bad. They want to be leaner, to be more confident or stuff like that. But, then I think a lot of people, especially if they're folks who are a little bit older, they may be a little bit more health focused, wanting to, live to see their kids or grandkids, graduate college, and not wanting to die of like a heart attack, or wanting to prevent diabetes, because that's something that, a lot of us kind of don't think about, but that's, something that is really closely tied to, obesity and our eating habits, and can have disastrous effects on your quality of life. Or, people with, same thing kind of with strength and fitness. Some people do want kind of the muscles just to, be aesthetic, but also people want to feel stronger. People want to be able to carry groceries. So there's a lot of different reasons. And that's something I think it's also important as a practitioner, when you're working with a client, to, always revisit that kind of what someone's why is, or there might be multiple whys there, because inevitably, whether you're working on your own fitness or nutrition, or you're working with someone else, there will be obstacles, there will be roadblocks. And for that reason, it's really important to have that, your why really, really, clear to you. And honestly, I think that goes for really any ambitious goal that you might have, be it fitness, or nutrition, or be it, with your career or financial goals or whatever else. It's very important that we know why we're doing it, because I'm sure many of us have been in a situation, maybe it's with fat loss or whatever it is, where we're working really hard and we're just kind of demotivated to do it. And we kind of forget why, we were doing it in the first place. Like, I know, before the podcast, we were talking a bit about, posting on Instagram, and how a lot of, influencers or people who want to, grow their Instagram following will just, they'll post because they feel like they have to, and they have to grow a following. And it's easy to forget why am I posting on social media in the first place? Is it because I want to have 10,000 followers so my ego feels good and I feel better about myself? Is it because I want to get more clients? Is it because I just enjoy writing and getting creative and stuff like that? So I know that was a little bit of a tangent, but I think it's just really important to always know why we're doing things, especially when we're working really hard towards something, because there will be, if it's a goal that's really worth achieving, there will be times that you don't feel like doing the work that you need to do, and that's when you need to know, okay, what is my why? Because it's easy to forget.
Absolutely. Yeah. Very, very easy to forget. And I think, with the time of year that we're in, where people are setting goals, like the New Year's resolutions and stuff like that, it's like, it's very common for people to set ambitious goals. But if you haven't really thought about why you want to build muscle, lose body fat, improve your relationship with food, it's very easy to fall off, the path, because, change is really, really difficult. And that's like something that people, it's very easy to forget when you get caught up in a trend like New Year's resolutions.
Yeah.
Yeah. So then, just kind of reflecting a little bit on the previous year that's gone by, I like to kind of recap. So what was the biggest health lesson that you learned, Dan, in 2022, if anything at all?
Yeah. So this is very specific to me. Okay. I'm not saying that this is like, I don't mean this is like a lesson that everyone should take, because I think different people need to hear different things at different times, in their life. But, in 2022, I worked, I'm just a kind of person. I really like work a lot. I'm kind of I guess like a type A, high strung. I work, I just like pride myself in working a lot and working hard and doing things well, which is great. It helped me build, a very successful business and, the Instagram stuff and, powerlifting and all this other stuff. But something I've kind of really been reflecting on over the past few months is not taking life too seriously. Because, working is important and, whether it be kind of working on your fitness goals, health goals, career, obviously finances and stuff. But I know, at least for me, I have a tendency to take myself really seriously and take my goals as though they're like the be all end all. And I think it's easy to forget that we're not the center of the universe, and most people don't care exactly how much I deadlift, or whether how good, my squats look this morning, or, whether I went over on my calories a little bit. And I think it's important to, something I've been, working on really is to laugh a little bit more, laugh at myself, being taking some time to actually enjoy life and just enjoy the simple pleasures in life, is really, really, I think, really important. Also, and I know we talked about this a little bit off air, spending a little bit less time on social media, I think is a good, for me, is a good thing. Because I think I've posted about this. It's I think our natural tendency to compare ourselves to those who are around us, and what is social media but a giant highlight reel? I get to choose what I post. I get to choose what I put on my stories, on my posts, reels, whatever. It's all carefully curated to look a certain way, and oftentimes when we're scrolling on social media, it's not when we're out enjoying life. It's when we're bored, maybe we're not feeling the best or what have you. And it's very easy to get sucked in to see someone's stories or see their physique or see, them talking about how successful they are in their private practice or their coaching or lifting or whatever. And it's easy to compare ourselves, how we are in that moment, to what that person is posting then. And that, can really do a number on your mental health. So, again, for me, not taking life quite as seriously, spending some time to relax, spending a little bit less time on social media. Yeah.
Yeah, really good. I feel as though I think it's the quote, it's like know thyself comes to mind. So it's kind of like if you know your own strengths and weaknesses, for example, for me, I can tend to be a bit too food focused. If I know that going into, like, for example, a meal, then I can more effectively manage that situation. And it's a funny coincidence, excuse the pun, but you mentioned, laughter, and I was just putting together like a blog post. I probably won't put it out, but I was just looking, I was like, I wonder what the connection is between laughter and health. And there's a lot of research on it. And I feel like laughter is like curative, it's like, your health can be so many different things, right? So that's like some really important points there. So just going back to, goal setting, and kind of the process of setting a goal. Like, let's say, for example, you have a new client and they're like, if this is my goal, you had a post basically, when's the last time you broke down your goal and asked yourself why it's important to you? So can you talk a little bit about like, what's a kind of a process or a framework you would use with a new client? And maybe even give like a kind of some common goals that they would come to you with, if there is any kind of, commonalities there.
Yeah. So, I mean, usually when I have, a new client, I will, on my intake forms, ask them, What prompted you to schedule the appointment, and then I'll have them list at least three, goals in order of importance. And then when I meet with them for the first time, I try and really dig deeper into that and see what their motivations were for scheduling the appointment, what kind of made them, decide to want to work with me, where that kind of motivation is coming from. And really, really kind of, emphasize that sort of motivation and really, really work from there, and using, motivational interviewing to really sort of emphasize, that motivation that someone has to change, because like I said, it's people are going to encounter obstacles. So it's very important that we emphasize that motivation and, really highlight, what we call change talk. So if I have if I, say we're working together and you've got a goal of, I don't know, you want to,
that's food focused. I don't want to think about food. That's what I want to do.
Okay. So if you want to be less food focused, I would probably ask you, a bit more about that and a bit, kind of like, what makes you want to be a little bit less food focused and, kind of seeing sort of what you say there and hearing a little bit about your experience about how, just make it up. Maybe you talk about how in the past you have been really food focused and really tied to your phone and tracking macros, and it made, social events more difficult, for example, or made it, difficult to, enjoy, your nephew's birthday party or something like that. So, kind of emphasizing that and really just getting at that and really, kind of emphasizing that change talk before we create, or discuss some short-term and long-term actionable goals, process goals, that will get us there. Hopefully that makes sense. It's a little bit hard to describe, just kind of off the cuff, but it usually goes something along those lines, really emphasizing someone's honest motivation to change and, treating someone with, respect and compassion while, really sort of emphasizing that motivation to change and, identifying barriers, as they come up. So, hopefully that makes sense.
Absolutely. Yeah. So it's like, you want people to be clear on why they want to change, because there will come a time where that'll be almost demanded of them. For example, let's just use the hypothetical situation of me with being food focused. And then I was in a social situation and I'm like, I have this goal to have a better relationship with food, but I'm in a social situation. Why am I actually putting myself through this? So if I was very clear on that from working with you, it would hopefully make the situation easier. And, I like that, the change talk. That's a really good thing to look for. And then also the positive regard as well, because, who's to say whose goal is better than someone else's. So it just makes me think of, given the current state of affairs, 60% of people are overweight. And a lot of people want to just simply lose body fat. I've kind of noticed myself, I don't know if you've noticed this, but a lot of people want to lose body fat because they think it'll make them happier. That's what I kind of hear. And I could be wrong. Maybe it's, I'm not doing enough work to actually dig deeper, like you mentioned. But let's just say, for example, you have a client whose goal is fat loss, and you dig deeper and they believe, a person believes that if I lose 10, 20, 30 pounds, I will be happier. What would you do in a situation like that? Just because I ask, in my experience, when I've been lean or when I've lost body fat, it hasn't made me happier. So if I have a client who comes to me like that, I'm kind of like, let's kind of think about this a little bit more, because I'm not sure that achieving that goal will bring about the desired outcome. What are your thoughts on that?
So if someone comes to me and says, hey, Dan, I want to lose fat, I want to lose weight, it'll make me happier, I would ask them why they think that. Why do you think, why do you not in a judgmental way? Because I don't know, I can't predict what will or won't make someone happy, but I just want to dig deeper and say, okay, well, why do you think it'll make you happier? And take things from there. Maybe they say, they'll have an easier time dating, I don't know, or maybe they will, they'll feel healthier, they'll be able to fit in their clothes more, or maybe better, or maybe they will be at lower risk for diabetes and they'll have less anxiety over that. Suddenly then we've kind of identified several other things, with dating, is it really a I need to lose weight issue, or is it a confidence issue? Wanting to, kind of fit in our clothes, same thing. And that's not to necessarily dissuade someone from losing weight. I see some practitioners do this where they say like intentional weight loss is inherently bad. I don't agree with that, but I just think it's important to also set realistic expectations about what, fat loss will and won't do, and to know why we're doing it. Because if it is, just because we think it'll help us, with dating, we might be in for a disappointment, and it might also make sense to focus on other areas like developing a sense of humor or developing a healthy sense of self-confidence, from there. So, it really comes down to just getting to someone's why, and really as a practitioner, taking time to listen to your client and really listen, and being able to sort of restate, what they said back to you as well, because sometimes people sort of hearing their own words, and having their own kind of thoughts reflected back to them can sometimes bring up some light bulb moments,
Absolutely. It makes me think of the quote, I only know what I think when I hear myself speak. So if you can reflect back to somebody what they say, then they can really understand themselves. And it makes me think of expectations then as well. So it's like, I think a lot of people, correct me if I'm wrong, but they have this kind of belief that fat loss, it's absolutely achievable. Like to lose whatever amount of body fat they want is achievable and that they can keep it off. But in my experience, it's very difficult once you put weight on, it's very difficult to lose it. And it might actually be the case that like whatever kind of body you're in at a current time, you might have to kind of stick with that and kind of try and improve other areas of your health outside of your body weight. So, how realistic do you think it is to lose, let's say, 10% or more of your body fat and keep it off for the rest of your life?
So I'm going to use my kind of cop-out answer again, and that's it depends. A lot of it in this case really depends on where someone is starting, so you said like 10% of your body weight. So if someone is currently at a spot where they are significantly overweight, where losing 10% of their body weight would put them most likely in an objectively healthier, body composition, body fat range, then that probably is more doable. Although that doesn't necessarily mean it'll be easy. We know just from literature that losing and maintaining a significant amount of weight, is the minority of people are able to do that. But if someone has a lot of weight to lose, it'll be easier. Whereas if someone is already, maybe they're already like, with their shirt on, they don't look like, overweight or whatever, but they want to get shredded. That is going to be extremely difficult. I don't say impossible, because I think technically most things are possible, but I think, for someone who's already doesn't have a ton of weight to lose and they're looking to lose a significant amount of body fat, that's going to be very, very difficult. And there's a decent probability that it'll have adverse effects on physical and mental health. But again, it depends on the person there. Anecdotally speaking, I do find that people tend to kind of have like a body fat kind of settling range that their body kind of likes to be at and performs optimally at, and once we go below that, it's very difficult to maintain and both for, physiological and psychological reasons. So again, it depends, and I do think that kind of settling point to some extent can, maybe be adjusted by adopting certain, long-term behavior and lifestyle changes, whether it be increasing just kind of daily activity or, eating a diet that's higher in fiber and fruits, vegetables, protein, that kind of stuff. But there definitely is, a threshold for pretty much everyone, whereby if you try and get leaner than that, the going is going to be rough.
Yeah, absolutely. I think we're somewhat limited in how much body fat we can lose, but what do you think of this? So then it's kind of like how much body fat or how much we can affect our body weight is limited, but how much we can improve other areas of our health is, it's kind of up to you in a way. So for example, your mental health or physiological markers like maybe blood pressure or heart rate, or, how much weight you lift on a bar, for example, or muscle mass. So if someone was to look past fat loss, and kind of put that to the side as maybe a secondary goal, and they focus on something else more manageable or actionable, that they could make a lot more progress in other areas of their health.
Yeah. Yeah. No, I mean, I would definitely agree with that. I think there's a lot of instances where, someone, regardless of where their current body weight or BMI is, where they can make, realistic changes to their lifestyle, whether it be with their nutrition or their exercise or their sleep habits or how they're managing stress to improve their overall health, physical health, mental health. If someone's not eating a lot of fruits and vegetables, probably by eating more, that's probably going to be a good thing, whether it just be from the vitamins and minerals and phytochemicals, that are in, fruits and vegetables. We know people who eat people who are in the highest quartile of fruit and vegetable intake tend to have the lowest rates of cancer and chronic disease, right? So even if you don't lose a pound eating more fruits and vegetables, if you don't already eat a lot, probably a good idea. Same thing with exercise. There is data to indicate that independent of weight loss, going from sedentary to, being more active, can increase health markers and reduce risk for chronic disease. So there's a lot of examples of this, strength training too. So certainly we can improve various aspects of our health without necessarily losing fat. And that's important, because I think especially in social media, a lot of us, tend to focus on fat loss. At least here in the United States, I think it's a big part of like our culture of, wanting to be thin or ripped or super lean, but that doesn't necessarily always equate to health improvements. And it can be really unrealistic for a lot of people. So I think it's just important that we have a broad definition for what being healthy truly looks like.
That's a really good point. Yeah. A broad definition, because there's so many different types of people. Like, for example, like fruit and vegetable, the example you gave, if someone was to eat more fruits and vegetables and it improved their digestion and they had like fewer digestive issues, that would be a huge improvement to their quality of life. Yeah. Or if somebody was able to do like, 100 kilos or 220 pounds on the bench press, 225 on the bench press, and they started at 50, but these two changes were independent of fat loss. So there was no fat loss, but they improved their digestive health, or they improved their bench press. Like, their quality of life could be way better and they didn't lose any body fat. So that's a really cool thing. Yeah, to keep in mind.
Yeah,
so
absolutely.
So another great post you had, Dan, was obesity is not due to being lazy. And I feel like this is, something I have a big issue with, that people, but to be fair to, the general population, I think it's kind of, from uneducated sources, it's kind of put out there that like, if you're overweight, you're lazy, and I definitely would have like believed that in some, part growing up, but then you just, you kind of get a dose of reality and you see that some people just, they are trying really hard and they still can't change their body composition. So can you talk a little bit about that post and that whole idea, and how actually, even in a broader sense, that the majority of adults in the US are overweight?
Yeah, so there's a lot to this, and it's funny, when I put out that post, I did get some comments that were, very like anti the, they were very like, you're saying that like you're just giving an excuse, like people just, need to, work hard, and you're giving an excuse for people not to work hard. And, that's not what I'm saying. I do think for many people, like for probably the majority of people with obesity, they do have, the ability to lose weight and potentially improve their health that way. But it's also important that we, as practitioners and just in the general public, acknowledge that if it was as simple as just being lazy, we wouldn't have such high rates of obesity and related chronic disease. It's a pretty complex. There's a whole host of reasons, that are behind, why obesity is as much of an issue as it is now. I mean, a big part of it, at least in the United States, is how much our food environment has changed, and how, calorie dense, hyperpalatable food is a lot more around, is very abundant, now, and how for a lot of people in a lot of environments, it's difficult to get in physical activity. I think especially for people who might be of, lower income, they might be in environments that are not as conducive to being active or walking. Maybe they can't afford a gym membership. Maybe they have limited access to healthy food. I think for a lot of us, having a supermarket nearby or grocery delivery is taken for granted, but not everyone has that luxury. Something that is also absolutely huge that people don't appreciate is the effect of mental health. And how that can affect our eating habits. Because, I mean, there are people who, and I've worked with plenty of people who, for their entire lives have used food as a means of coping with really difficult, depression and anxiety and trauma. And that is not a willpower issue. That is a deep kind of psychological, issue that is not just I stop. It's not like that. You know what I mean? And if you've ever dealt with, significant anxiety or depression, that it's not a willpower issue. There are certainly genetic components as well that predispose some people, to, obesity more than others. There's a lot at play, there. And again, I'm not trying to say that weight loss is bad, or that people who have obesity shouldn't try to lose weight, but it's important that we don't fall into the trap of shaming people for their weight, because that does not work. And that's something that is actually an obstacle for people who have obesity, who do want to improve their health, is weight stigma from from practitioners who write them off as just, being, fat and lazy, or people who have obesity who avoid the doctor because of, stigma that can bring up, and being shamed about your body, or, you have got a genuine medical issue and the doctor kind of just, shrugs it off as just, you need to lose weight. We need to, as practitioners, be kind of more compassionate and empathetic to the various kind of the nuances of obesity, and we need to be mindful of that, so that when we help people who want to improve their health, we don't fall into the trap of telling people that they just have to work harder, because that works for a minority of people, but for most people it doesn't. For most people, just focusing on willpower alone does not work. So it's not it's not me trying to kind of, like I said, sort of make people who have obesity feel good or anything like that, but it's just about being a decent human, it's about understanding people more, so yeah, I mean, it's yeah, I don't know what else to say about that.
Yeah, no, it's about being fair with people, because basically, for whatever reason, and this is my follow-up question, but why do you think obesity is on the rise? It's a case of the reality is, whether we want to say that it's laziness or whatever, it's the majority of people are unfortunately overweight. So it's given that fact, what's the best approach we can take? And to call those people, the majority of adults in the US, and, we won't talk about any other country, but just in the US, to call them lazy, what good does that do them at all? It's if somebody's in debt, we wouldn't just be you're financially incapable, so, figure it out yourself or try harder. It's no, let's try a different solution. It's kind of just meeting people basically where they're at and being fair to them. So,
yeah,
that leads me to my follow-up question is, why do you think, if you had to guess, And I know it's very complex. Like it's not a straightforward situation. Why do you think that obesity has risen? What do you think is some of the main causes for it? You know, what's going on?
So I don't want to say I'm necessarily like an expert on all the reasons why, you know, obesity has increased. I think it's, you know, there's a lot of factors there. Um, you know, but I mean, at least in my professional opinion, I definitely think that, you know, like I said, I do think that changes in our food environment have definitely played a role in just the kind of increased convenience of really tasty, hyper palatable, you know, energy dense food, you know, that's readily available and oftentimes cheaper, more accessible, you know, certainly plays a role. I do think that the increase in kind of just convenience in general, like kind of technological advances that have made life more convenient, you know, with you know cars and just you know other mobile transportation, you know, has meant that we don't have to move around as much. Oftentimes, I think urbanization, you know, plays a role. You know, probably just you know just kind of technology in general, having kind of more technology, you know, available, you know, TV, cell phones, stuff like that. You know, a lot of people maybe aren't as active and don't spend as much leisure time, you know, engaged in physical activity. I mean, those are just a few off the top of my head. Like I said, I think it's really, I think it's complex. And I don't want to pretend like I'm an expert on all of the reasons, you know, why, you know, obesity has risen. And I think it's a nuanced factor. It's a nuanced problem there, but I do think that those factors at least play a role there.
Yeah, 100%. Yeah. We don't actually, when I say we, I guess basically, the experts who research obesity don't have a conclusive reason as to why so many people are obese. Yeah. And it's through no one's choosing. No one would choose to be obese. It's just an unfortunate reality. But people are working very hard, and I think that we'll learn a lot more about it. And the best thing that we can do right now is give people a break who are struggling with their weight, and to think of what we can do to help them as opposed to putting them down.
Exactly. Exactly.
So a really kind of hot, what do I call it, almost clickbaity topic that you had, Dan, was pre-workout is just overpriced caffeine. So you don't really do much clickbait stuff, you know, and this is just one that was a little bit more popular. So we're switching it up completely. But I think a lot of people use pre-workout, or I'll randomly think that pre-workouts are kind of gone, you know, like that, you know, that phase of people working out and being into their fitness is over. And then someone will be like, oh yeah, I got this great new pre-workout. And I'm just kind of like, have we not learned, kind of back to your point off air of repeating things to people? It's like, have we not learned that pre-workout is not really, it's a whole lot of, it's a bit of smoke and mirrors in my opinion. So yeah, what is your opinion on pre-workouts? And I know that you've got like, your whole background is nutrition. So from like a nutritional point of view, like what's going on with the pre-workout versus caffeine?
Yeah, and let me say like and I mean my caption on that was more nuanced, but you know, inevitably a few people just saw the picture and was like, "Oh, this is bullshit" or whatever. And I kind of posted that as like kind of a tongue-in-cheek kind of meme because I thought it was funny. But the idea with that is that in most commercial pre-workout formulations, caffeine is really what's getting you most of the performance enhancing benefit. You know, for the most part. I mean, and then oftentimes the other ingredients that are in there, you know, they don't have a huge effect, or they might be a bit underdosed. I mean, I'm not saying those non-caffeine ingredients have no effect. You know, citrulline malate, 6 to 8 grams per day of you know of citrulline malate, and 2-to-1 ratio of citrulline malate, citrulline to malate. You know, can may increase a little bit of strength and power performance. Beta alanine, that's the stuff that gives you the tingles in pre-workout. That, from if I'm remembering correctly, can help with a little bit of longer duration stuff. Not as much with just kind of pure strength, you know, but I think reps to fatigue, that might be a little bit better for. You know, there's some evidence looking at betaine on the potential benefits of that. You know, but basically it's what I guess my point was there is that most of the benefit you're getting from most pre-workouts is from the caffeine. And if you did want to save your money, you could just have straight up caffeine. Like I use caffeine gum, or coffee or something like that. But at the same time, if you have a pre-workout that you enjoy taking and you don't mind spending a few extra dollars, nothing wrong with that. Again, I just thought it was a kind of like I kind of came up with the idea of the meme, and I was like, I just think this would be a funny meme, and it got almost 2,000 likes. So take with that what you will. If you want to use a pre-workout, it's fine. But if you're looking to save some money and you still want to have a great workout, you could just have nothing, or if you're not training in the evening, just sticking with caffeine, I think is just fine. Or just some carbs.
Yeah, I got a kick out of the post. I thought it was hilarious.
Yeah.
And I know from experience that the pre-workouts almost get me like too amped up, whereas coffee is cheaper and it gets me kind of like worked up, or I don't want to say worked up, gets me ready for a workout with fewer side effects. And it just makes me think then, is there any studies comparing coffee to a pre-workout versus like nothing at all? And is there any kind of like evidence to say coffee alone is better or a pre-workout's better?
There might be. I'm honestly not familiar with them off the top of my head. I'm going based on the research, looking at specifically, caffeine versus these kind of other individual ingredients. I'm sure there are. In fact, I know there are studies looking at specific pre-workout formulations, but I'm not aware of any off the top of my head that are comparing just caffeine to caffeine plus beta alanine and betaine. But there might be just out there. I just haven't looked at them. So I'm not 100% sure then. And again, like, it's not one of those, it's kind of just like a tongue-in-cheek thing. Like, if you want to it's not going to hurt unless, you're taking it at night and, it affects your sleep, or you take too much of it and but it's, and if, like I said, if you want to save some money and you want to just have caffeine, I think that'll work just fine.
Yeah, absolutely. I've used pre-workout, caffeine tablets, cups of coffee. I think cups of coffee are the simplest, most enjoyable, and most cost-effective pre-workout you can get. But, until someone's tried them all, they're kind of always wondering, what if? So keep that in mind. And if you're on a budget, I would just recommend coffee. So
for sure.
Another very interesting topic is sweeteners, like low-calorie sweeteners, non-nutritive sweeteners. What does the research say on those? Because I've heard some people say, or there's some actual research to say that these like sweeteners can cause cancer, which is like very scary. Obviously, nobody wants cancer. It's a terrible condition. So it's like, I'll just avoid them. But is there any health benefits to using sweeteners? Do they cause cancer? What does the research say? What's your opinion on them?
So specifically non-nutritive sweeteners, I know it's one of those topics that people, if you do some Googling on artificial sweeteners, you'll see all kinds of claims about all different, kind of health issues. Most commonly, people worry about cancer or, diabetes or obesity. From my understanding, all of the research I've looked at in humans does not support, a causal effect there. You will find some rodent studies here and there where they give a mouse like a bunch of aspartame or something like that, and they'll have more cancer. But I think even the rodent studies, that kind of looking at them as a whole, do not suggest that artificial sweeteners, are linked to cancer or diabetes or really anything like that. They've gone through some pretty rigorous safety testing, and when again, I'll just kind of stick to the United States, when I believe it's the FDA set the adequate daily intakes of different sweeteners. It's basically they determine the highest level of intake that's considered safe, based on the available literature, and then they add in a 100-fold, a 10-fold or 100-fold safety factor in there, and then that's the adequate daily intake, and it's quite a bit of artificial sweeteners per day that you'd have to get up to that. So the risk there is very, very low. So I don't think it's really something that you have to worry about with regards to cancer or really any other health issues. Now, am I saying that you should just drink tons and tons and tons of Diet Coke and have just tons and tons and tons of this stuff? No, probably not. But I don't think, on our kind of hierarchy of priorities when it comes to fitness and nutrition, I don't think it's something that's particularly important, particularly something that you really need to worry about all that much. And if anything, there is, some research in humans suggesting that when people replace sugar sweetened beverages with artificially sweetened beverages, that we do generally see decreases in body weight and improved blood sugar control. So if you're going to use it as a replacement for sugary beverages or a lot of sugary foods, I do think that's a step in the right direction.
Absolutely. Yeah. I am not an expert on sweeteners. I'm not a dietitian. I'm just a simple personal trainer with my postgrad. But I would say if someone was to switch from a full calorie soda, full calorie, your typical drink and swap in, diet or lower calorie sugar for the full calorie version, they would improve their health over a lifetime. I would bet a significant amount of money on that, but of course I'm not the expert. So don't take what I say, seriously.
Yeah, I would agree with that.
Good. So good to know I have you on my side. Yeah. So the final question, Dan, I won't take any more of your time, but supplements is something that I think a lot of people spend a lot of time thinking about. And, it's kind of hard to know what's the real stuff, what's the fake stuff. Just my own stack is I take a multivitamin, I take fish oils, creatine, and then whey protein. I feel like that's a very bro stack and it could be a lot more sophisticated. What do you recommend to your general client just for general health and well-being? And then is there anything that's kind of if you're looking for a little bit more of a health benefit that's maybe not as well researched that might be worth considering?
Yeah. So, I think for most people, a multivitamin is a pretty low risk, low cost option there. Just a general multivitamin just to kind of, assist in making sure you're getting all your vitamins and minerals probably is a good idea. For people who don't already eat a decent amount of fatty fish, and a fish oil or an omega-3 supplement can probably be helpful there. And for people who either have a vitamin D insufficiency or deficiency, or don't get a lot of sunlight, or in the area of the world where there isn't a lot of sunlight, maybe supplementing with vitamin D would be a good idea, although I do think it probably makes sense to get your levels checked before you do that. If you are interested in strength and hypertrophy specifically, 5 grams per day of creatine monohydrate will probably offer a small benefit there. That's really it. If someone has a specific vitamin or mineral deficiency, they could do that. I talked about caffeine being helpful for, working out, and most of us probably use caffeine in some form or fashion just to, wake up in the morning and kind of feel a little bit more alert. There aren't really any more that come to my mind that I think are particularly notable, honestly, when it comes to that. I think, supplements, most supplements are, in my opinion, overrated.
Great. And I love how you didn't mention pre-workout. I'm a big fan of that. People saving their money.
Yeah.
Just a question I'm thinking of is, do you think that everybody in the population, bar people with, I think it's kidney disease, should they supplement with protein based on the benefits, based on the research? Should the majority of people, unless contraindicated, supplement with protein?
I don't think so. I don't think so. I think it's, if someone is looking to increase protein in their diet and they're unable to do so with food, then I think supplementing with protein can be a good idea. But I think just supplementing with the protein powder just because, I don't think makes a lot of sense. If you are someone where you're not already getting a decent amount of high quality protein from, meat, poultry, fish, dairy, or eggs, or tofu, soy, particularly if you are, looking to build or maintain strength and muscle, and that's important to you, then I think it can be a good idea. But it's definitely, I wouldn't say supplementing with protein should be a recommendation for everyone, and if you're looking to lose fat in particular, maybe because of the potential for increased satiety, but I don't think it's something that's necessarily applicable to everyone. I think plenty of people can live a long, healthy life and just sort of eat, include a decent amount of, whole food protein in their diet. Just be fine.
Interesting. Yeah. I'm not sure. Am I so biased that I can't see the truth, or do I need to do more research? Maybe if I have you on again, I'll have a better case for why I think everybody should supplement with protein. But I've taken enough of your time, Dan. Is there anything you want to wrap up with? Any message you want to leave people with?
I don't think so. Just like I said kind of earlier when you were asking me about kind of lessons I've learned, not taking life too seriously. And there's a balance between working hard towards your goals and wanting to do things and having lofty goals, but also enjoying life and like I said, not taking things too seriously.
Yeah, absolutely. Like fitness is additive to our life, like we said already.
Exactly. Exactly.
Yeah, exactly. So we can definitely enjoy improving our health without the goals that we're chasing after. Thanks very much, Dan. See you again soon.